Then we go over to treatment of personality disorder. People with personality disorder might not seek treatment on their own. Yeah. And as a result, many go untreated. One reason for the failure to seek treatment might be that many people with personality disorder can function normally in society outside of the limitations of their disorder. You can see someone who has a personality disorder working in a big office. So, personality disorder will not prevent the person from being in an office, from being a governmental agent, from being in governmental services. No. That this person is suffering from personality disorder, it is not quite a disqualification for this person not to work in a particular firm, in a particular organization, or not to work at all in the society. No. The only thing we are talking about at the side of personality disorder is that sometimes the relationship these people have with others may be a contribution to what we may be seeing as what? A problem. But it doesn't mean that this person cannot calculate, that this person cannot do something with his or her brain. No. They can work as you want them to work. But the only thing is at the side of how they relate to people, how they interact with people, how they do at their workplaces. These are those things that contribute to a disorder in that person's personality. Hope we are following. Okay. So, most personality disorder are constant and unrelenting and very hard to cure. I have seen a person suffering from a personality disorder, that is paranoid personality disorder. This person suffering from paranoid personality disorder, whom we know that those suffering from paranoid personality disorder, as we have earlier discussed, they always suspect others. They always see it that even when they open up to you, you will use those things against them. They always see it that whatever they are doing with you, your thought about them is just to kill them, to eliminate their life, to attack them. So they always fill up with what? Suspects. Whatever action you give to them is under suspect. So that is a problem. So this person suffering from paranoid personality disorder is working in a firm. He's working in a firm. Now, another problem there is most of them do not agree that they have a personality disorder. Most of them. Someone may have a personality disorder but may not agree with you that he or she has a personality disorder. So, if a person should not give in to your observation that he or she is suffering from a personality disorder, then there is no way you will cure the person. The only time you will cure the person is when the person has affirmed that he or she has a disorder. It is that time that you will now give a solution. You will now give an assistance to that person. But when you are still under argument with this person, whether he or she is suffering from a personality disorder or not, it is not yet ready to be cured. The person is not yet ready to give in to what? A treatment. So that is what we are talking about. So, treatment varies depending on the type of disorder. But psychotherapy, that is a type of counseling, is the main form of treatment. You know, some of the treatment that are given to people with personality disorder is not just to give them drugs, medications. Sometimes it is under counseling. You counsel the person. When you counsel the person and the person accepts it, and then begin to work on whatever therapy he or she has been given to follow. If the person follows the therapy, it works out, then the disorder will disappear. The person will now move from the wrong side to the right side. So in some cases again, medication might be used to treat extreme or dissembling symptoms that might occur. So sometimes again they make use of medication, maybe when the disorder is very, very high in that person. So medications that might be used include the antidepressant. Someone who is now depressed. So there are some medications for antidepressant. You give the person the antidepressant to enable the person to come back to his or her normal senses again. Another is antipsychotic, anti-anxiety, impulse stabilizing medication. All these things are the medication that may be used on a person with a personality disorder. When you give the person all these medications, it will help to stabilize everything. Anti-anxiety, anxiety. Give the person the anti-anxiety medication, the anxiety will disappear. The person will be normal again. So, the psychotherapy focuses on evaluating faulty thinking patterns and teaching new thinking and behavior patterns. Psychotherapy. The psychotherapy. They focus on evaluating faulty thinking patterns. This person sees an action from you and then he thinks about another thing in a negative form. So the psychotherapy will help to correct the bad thinking the person has about on a particular action. Then you use the psychotherapy again to teach the person about new thinking. Please forget about this your old thinking. This is how this thing should be. This is what this thing should be. This is a new thinking about this. And that new thinking is a normal thinking for every normal human being. Then you teach the person about the behavior patterns, the new behavior patterns. You should desist from this old behavior pattern and then go for this behavior pattern. This your old behavior pattern is wrong. Leave the left side to the right side. These are what the psychotherapy will assist the person in achieving. So, the therapy also aims to improve coping and interpersonal skills. So, these are the things that we will achieve when we want to treat a person of this disorder.